Hannah Murray on TRE in the afternoon.
Good afternoon. Joining us on the line now is Dr. Marisa Martin from Cudeca to tell us about their Be Cudeca Heart campaign. Over the last 10 years, the number of patients cared for by Cudeca has nearly doubled. Despite all efforts, the demand is growing every year. And by the end of 2024, it is estimated that the number of people needing Cudeca care will increase by over 200, reaching more than 2,100 patients. So we need to get behind this crowdfunding initiative, Be Cudeca Heart, to raise necessary funds to continue to help those patients with cancer and other life-threatening illnesses. Welcome to the show, Marisa.
Hello, good evening.
Hi.
Nice to be here.
Oh, it's lovely to have you. Thank you for joining us. So this is a great idea, this campaign. I mean, it's obviously sad in a way that you're getting that many more patients. Tell us why you think that is. What's it been like in the last 10 years? How have things changed for you?
Well, I think many things have changed within palliative care first. You know that palliative care is a very new discipline, a medical discipline in Spain. It's only been now going for 35, 40 years. And in UK, it was there many, many years ago in the early 60s. So nowadays, more people are aware of what palliative care can offer when you have a threatening illness and you're at the end stage of your life. And of course, we all know that each year we grow older and we survive more now. We live longer, but we live with a poor condition related to illnesses. So it's one, because it's more known, B, because we've got an older population, and also C, I think it's because it's not only cancer patients, of course. We are looking after other serious illnesses that are facing the end of life. And we also have begun to care for children, although that isn't a big amount in numbers. I mean, it's very dedicated and very delicate, very delicate, but it's not really a huge number of children right now. So it's growing, and it's growing everywhere, really.
Yeah. And yes, I think a lot of people will have the wrong impression that you look after only cancer patients. But as you said, it's palliative care really is for anyone who is at end of life for whatever the reason.
That's right. The truth is still in Cudeca, I would say 85 to 90% of the patients we care for are cancer patients. But there is a growing number each year of patients with other illnesses. It could be dementia, it could be motor neuron disease, it could be neurological illnesses. Any type of threatening illness has the same right to be treated in the best way possible at the end of life, of course, than a cancer patient.
Yeah.
Normally with cancer patients, the end stage of the life is more intense and it's shorter in time. But with other illnesses, sometimes it's more a crisis situations where the team go and treat the patient in coordination with their GPs or their reference doctors, and then we retire and we just stay there in the background. But with cancer patient, that's very difficult. Normally, once we begin to be there, we're there until the end.
Yeah. So just tell us where this money would go. What is it that you need money for?
Yes, well, last year, really, the increase of the number of patients has grown, as you just said, Hannah, nearly more than double in the last 10 years. But the truth is, after the COVID situation, patients, there was a big raise in numbers too, because many patients hadn't been well diagnosed during the COVID during the COVID period. So that made us have a big demand. And in 2023, the teams were really not being able to cope with the demand. So in 2024, we put up 2 new teams, not one, 2 new teams of doctor and nurses so that the teams could not be so stretched out. The truth is we did a campaign last year and we managed to make some funds, important funds, 125,000 to at least support one of the teams. But as you just said, in 2023, we ended up caring for 1,900 patients. And this year, we're going to care for nearly 2,100 patients. So as you said, it's 200 patients more, and that means a whole team more. Yeah. So that's what we're looking for, to be able to maintain the two new teams that we set up last year and be able to have the funds to keep them with us.
So when you say a team, what does a team consist of?
A team is a doctor and a nurse, and they are supported by a psychologist and social worker. But the team itself is doctor, nurse in the car. And what we normally do is we allocate them a region or a municipality. So right now we have 4 full home care teams working on the Costa del Sol. We have 2 home care teams in the interior side of Malaga, in the village part of Guadalhorce. And then we have 3 more teams working in Malaga city centre.
Wow. So these teams are caring for multiple people, are they?
That's right. One team shouldn't have more than 50 patients at only one time. And the average of patients that we have right now today is between 550 to 600 patients. They're in their homes and they're being supported and cared for by the Cudeca teams, together with the local GPs and the local primary care teams. Only for you to have imagine what it is like. Last year, the average of new patients coming to us each month was 110.
Oh my goodness.
It's such a huge demand, Hannah. So you can imagine how stretched out and how they really were exhausted. The home care teams really were exhausted. And that's why we did this big effort from the funds we have as a reserve. We took them out and we contracted 2 more teams, because it wasn't being good for the patients on one side, and it wasn't either good for us either, because we weren't satisfied with the care we were providing.
Yeah, no, absolutely. And I mean, you don't want to say no to people, do you? If people come to you for help, you want to be able to say yes every single time.
Yeah, that's right, because there's not a second chance when you're facing end-of-life care, is there? Mm-hmm.
No, exactly.
And still sometimes, and I must, it's not very often, but sometimes we aren't there in time. So it's for us, that's a failure. But the demand is so big right now. And as I said before, people in Spain are much more aware of what palliative care could mean to their lives and their loved ones now.
Yeah.
So they also demand the care, of course.
Yeah. Oh, it's invaluable. And this might be sort of going into too much detail, so I apologize if it's a lot for people to hear. No. But at what point should people get in touch with you? Do people know generally what end-of-life care means? I mean, what kind of time scale are we talking?
Well, that's a good question, Hannah, because it depends so much on the individual situation. Right now, what all healthcare systems are trying to do is prepare all professionals in any health service and in any health system to know what basic palliative care is about, because there's no way that the palliative care teams, we can care for all of the population. It's not possible. And so what we try to do is evaluate the situation on the complexity of the situation. And the complexity can be because of a poor symptom control. It can be because of a very emotional and distressful and not coping situation at the psychological part of the situation. It can be a social problem, or it can be all together and mixed up, which is normally is, especially with cancer patients. So what we try to do between the GPs, the oncologists, and the palliative care teams is evaluate the situation. If the GPs are prepared and can care for them, they will only contact the palliative care teams when necessary. But if the doctor that is the reference for that patient identifies that the situation is complex, they will ask for the palliative care teams to come in and support the care. So really, it's very, very individualized. And what is true is that when I began doing palliative care, in 1991 was when I cared for Fred Hunt. So, and I had just begun 1 year before. So I was very nervous when I had to care for Joan and her husband still. But anyhow, when I began, the average of what a patient would stay under our care was 3 months to 6 months. Okay. But now, WHO, the World Health Organization, and other important organizations in health don't want to define it by time. We have patients that are with us for a year or 2 years sometimes because perhaps they're not a cancer. They don't have a cancer illness. They have another type of illness, and that means they can be longer with us, and we can just step in when it's really necessary. And other patients are with us for a week. So it's not so much now the time or the prognosis, it's more the complexity of the situation.
Yeah.
And that is evaluated by the whole team that care for the patient and their families. But it is important to know that it's not just end-of-life care what we try to offer. We try to offer a support system to live the best you can right until the end.
Yeah. And also not underestimating the help that you give the family as well, the people who are looking after the loved one who's suffering. That's hugely important.
That's vital, because without that support, it's impossible to stay at home. It's like having the family turn into the nurse, the doctor, the psychologist. They have to do everything. So we support them with our telephone line. We have an all year long telephone line for the families that they can contact us right until 6:30 in the afternoon. So we have it from early morning to 6:30 in the afternoon, and they can call us, and we have all the information about that patient, and we can supply them with important support. And if we think the patient really needs to be seen by a doctor, then we will tell the family just to contact the emergency service. Yeah. But sometimes on the phone, we can, because we know the patients, because we've got their records and we've got their treatments under our control in our computers, we can support them, and they can, sometimes we avoid them having to go to the emergency services.
Oh, absolutely. We've had a message through from one of our listeners, William, who says, Cudeca were amazing for my dad. They provided advice that the hospital couldn't give and found a brilliant care home when it was urgently needed. So thank you. So that's nice to hear.
Well, thank you, William, because that's what Cudeca is about. You know, if we get this, if we're capable of providing this kind of care and support, we feel honoured and we feel happy.
Yeah. And I also want to thank you because Cudeca were amazing for my mother as well a couple of years ago. So I have personal experience too. And yeah, I think you're all amazing, Marisa.
Well, thank you. We do our best. We certainly do our best, but we feel motivated because we have this huge support, incredible support from the community. And it's such a different way of providing care than, you know, the public health services. And we feel very, very proud of the support we have. I always remember the words of Joan. When we were beginning, I'm sure, Hannah, you've heard me say this story many times. I used to say, okay, Joan, I'm a doctor and I know about palliative care. I'm learning. I'll be able to lead you there. But where are we going to get the money from, Joan? And she didn't really think it was a problem, Hannah. She looked at me like, oh, Marisa, don't leave that to me. You know, she says, people are compassionate, people are kind, people look after their loved ones. We just have to do it right. If they believe in us, we will have no problem. That's what she used to say. if we do it right, then they will be with us and we will have no problem. So God bless her. I hope she's still somewhere near us. I'm sure she is. And she motivates you all to be with us in this campaign, of course.
Oh, definitely. You are doing it right. So she was exactly right about that. Amazing woman she was. If people want to get involved and help out with this campaign, it's called Be Cudeca Heart. And there's a link on our website, TRE.radio, so they can pledge money and find the details on our website. And if they want to go directly and find out more information, there's a separate website, becudecaheart.org, with all the information on there. But this is a 3-month campaign, isn't it? So this is something that we need help with now.
That's right. It's a nice way to once again ask for money. Of course, we have to. There's no other way that we can care for patients. But it allows you, each one in the way they can and whatever they can afford. If it's €5, if it's 10, or if it's 1,000, it's just a once-off. We will be banging on everybody's door for 3 months, just saying, be a heart, be a heart Cudeca for us this time. And I'm sure you know that all your efforts and all your support will go directly to the care.
Yes, oh, absolutely. Marisa Martin, thank you so much for joining us. It's always lovely to chat with you. And I can really say thank you so much on behalf of me and my family and the radio station and the whole community. Thank you for the amazing work that you all do.
Yeah. Thank you, Hannah. No, thank you. I mean, you know that TRE has been part of Cudeca since the beginning. The biggest campaign we've done in crowdfunding was thanks to Martin Nathan's idea of the 1 million campaign, because Joan was 1 in a million. We did a 1 in a million campaign, and we achieved €400,000. So that was a big one, anyhow.
Yeah,
we didn't get the million. We got a lot of money. So thank you. And I hope that soon, in a month or two, I can come back to you and say, Hannah, look at all this money coming in.
I hope so too. Fingers crossed. Thank you, Marisa. Take care.
Thank you, Hannah, and all the team. Thank you.
Bye-bye.
Bye.